Good afternoon, everyone, and thanks so much for joining us here in the KXAN live studio. I'm Will DuPree. We want to update you about a situation that's unfolding in the western part of our state in El Paso. We're talking about El Paso County going into an overnight lockdown and also working to set up temporary hospital space to deal with the worsening COVID-19 situation. Fortunately, we're able to pull in a reporter from BorderReport there in El Paso. Joining me right now is Julian Resendiz. Julian, thank you so much for joining us. We really do appreciate you taking time out of your busy day to talk about what's happening out there.
My pleasure.
First of all, we want to talk about the record numbers in terms of new COVID-19 cases and hospitalizations. What did the city share earlier today?
We had more than 1,400 new COVID infections and one fatality. This is a trend that has been ongoing for at least the past couple of weeks. And 2 weeks ago, we were warned that this was going to happen by health officials who were very preoccupied with what we're seeing in the community. They call this the COVID fatigue factor. That is people being tired of being locked up in their homes or just going out to work or to do essential shopping. They were particularly concerned about family gatherings, which are very common here. This is not a wealthy community. People don't go out to places. They go visit relatives. And apparently those activities have been resuming as of late, and that's what might be causing the spread.
Yeah, that was my next question, is what are officials saying is the reason for this spike? You mentioned a lot of family gatherings. Anything else that they're saying this is why this has happened at this point?
Yes, there was also concern about gatherings at bars. Bars have been closed since the spike began. Also people going out to common areas, but that also has been done away with through the latest restrictions. Primarily, it's family gatherings. There have been reports of some unauthorized parties here and there, but it's mostly family gatherings.
The county also issued a curfew from 10 p.m. until 5 a.m., and I believe that went into effect for the first time yesterday. Is that right, Julian?
That's correct. Just now, I'm back from downtown El Paso and some of the neighborhoods in South El Paso to ask people about the curfew. And what I found out is that most of them don't know that it's in place. So I don't know if it's a language barrier. South El Paso is primarily Spanish-speaking, or just that the news has not filtered yet. But a lot of people still don't know about the curfew. The curfew is pretty much an extreme emergency measure to get this thing under control. But if people don't know about it, they may not comply with it.
How are they enforcing that curfew at this point?
They haven't been very clear, but obviously if you're out and about after 10 p.m., you're likely to be stopped, especially if you're walking. Ask where you're going. You can only be going to work or to get some essential services, such as, well, I'm going to the pharmacy to get some prescriptions, or just essential type business.
We had reported earlier this morning about the El Paso Convention Center serving as kind of a temporary hospital space. What is the situation there with hospital capacity? From what I understand, capacity is 100% right now.
Capacity for COVID patients is at 100% at most of the public hospitals here, also some of the private facilities. They're very concerned particularly about the intensive care unit area because that's going to affect non-COVID patients. Somebody comes in with after being in an accident, and there might be problems accommodating that person. So that's why they're very concerned about ICU. Now, as far as the convention center, I was just down there a couple of hours ago. They're starting to set up one of the mobile facilities, mobile field hospital, if you will. Right now, I saw some trucks in the parking lot. It's still not up and running, but from the trend that we have been seeing in the past couple of weeks, health officials here believe it will definitely be necessary to have that field hospital. It can accommodate up to 100 persons at a time.
Just give me a feel of like what people are feeling at this point in the community. I mean, how are people reacting to this really troubling trend in terms of new cases and particularly hospitalizations?
I think to this date, there's still a lot of disbelief in the community. People are still digesting that this is a really bad pandemic. one that has serious consequences. I think especially in the younger community, it still hasn't gotten a hold of how serious this is. And according to El Paso health officials, those are the young people that are mostly going out and about and catching the virus, perhaps being asymptomatic, but then they go home and spread it to their older relatives, especially at these family gatherings. Maybe they go and see their parents, their grandparents, their uncles, and the latter are the ones that are getting really sick and going to the hospitals. So I think there's still a lot of lack of understanding of the seriousness of the virus. And also, as I was mentioning, a lot of people see these family gatherings as like part of their lives. I've talked to people on the street, and they tell me, look, going to see my parent, that's essential to me. I spoke to some people who were coming over the international border today who said they had gone seeing relatives. One of them, for instance, said, well, somebody in my family just died. How is myself going down there to present my condolences not essential? So there's a lot of ambivalence about this pandemic.
You all have also been reporting about the situation getting worse just across the border. What's happening there, too?
Pretty much the same thing that happened in El Paso just now. Juarez is also on a lockdown as of last week. People can go out between the hours of 10 p.m. and 6 a.m. Hospitals are at capacity. Just now, I got off a teleconference when they were talking about setting up a field hospital at on the parking lot or near their public hospital, which is totally full. Now in Juarez, we have another situation, and that is that nobody really knows the real scope of the problem. And the reason is testing. El Paso is doing thousands of testings per day, testing possible COVID, people with COVID infections. In Juarez, pretty much they test you if you go to a hospital and you're feeling sick. So we really don't know the true scope of the problem in Juarez. We know that they have a lot of fatalities, twice the number of fatalities as in El Paso, because they have pretty much the people who died. However, they are reporting only a fraction of the number of infections that El Paso is reporting, and that obviously means that they're not testing sufficient people.
People may be hearing this and watching this right now and thinking, you know, this is happening in El Paso, but it really should serve as some kind of sort of a warning for the rest of us in the state to see what situations could arise if people don't take these precautions seriously. What are the health leaders there and the public officials saying about the things that need to be done? I would imagine it's wearing your mask and keeping your distance and washing hands, all of those things that have been repeated over and over and over again for the past few months.
That is totally correct. That is exactly what El Paso health officials have been saying, not just over the past 2 weeks, but over the past 6 months. As I walked around South El Paso and downtown El Paso today, I did observe that most of the people I saw were wearing masks. They weren't gathering close together. The problem is when they go to their homes, when it's the weekend and they go visit their parents. Those are habits that have been formed over generations. And that's where the message needs to get through. For people, whenever they go see their relatives or close relatives, to pretend that they're out on the street and wear the mask and don't touch their relatives. That's something really hard to do down here. Most of the time when you go and visit your parents, the first thing that you do is you hug. So it's going to take a lot more communication, a lot more work. And like I said a while ago, maybe there's also a language barrier, because a lot of people today have no clue that we're under an overnight curfew.
Julian, remind people once again about the stipulations with the curfew there in El Paso County at this point.
Yes, the curfew enacted last night means that people cannot be out on the streets between the hours of 10 p.m. and 5 a.m. unless they're going to work or unless they're going to procure some sort of emergency or essential items such as going to the pharmacy. Also, officials are talking about fines for individuals. I think this is something that's been in the books for a while. However, health officials were mostly concentrating on businesses as far as the fines, as far as the hardcore enforcement. And now they made it clear that if people are out on the street without a face mask, they face a $250 fine. Also, businesses not in compliance, especially with the new order, face a $500 fine.
Julian Resendiz, thanks so much for joining us. He is a correspondent for BorderReport, which is a reporting project through Nexstar, our company that owns even KXAN. Julian, thank you so much for joining us and reporting about what's happening out there. We're going to try to keep touch and keep tabs with you to see what's happening out there, because this really could be a situation that happens elsewhere in the state, and unfortunately you all are dealing with it right now. Julian Resendiz, thanks so much again for joining us.
My pleasure. Thank you.
All right, everybody. Again, that was Julian Resendiz, a correspondent for BorderReport. We have his reporting over on our website. That's KXAN.com, and on the KXAN News app on your smartphone. You can read about what's happening there in El Paso and El Paso County regarding COVID-19, reaching new record levels in cases and hospitalizations today. A curfew is in effect, and you can read more on our website. Thanks again, everybody, for watching. I'm Will DuPree here in the KXAN Live studio. We appreciate it. Please, everyone, stay safe and stay healthy.